Tonight, an I-Team exclusive.
So our physical health.
Exactly 6 months after the Oregon District mass shooting, we take you inside a first-of-its-kind class.
What happened in January?
Aimed at helping Dayton police heal their invisible wounds.
We just don't want to recover and say, well, we survived it, right? I lived through it. No, we want to go back to thriving.
Plus, the proposal supporters say will help train officers to better deal with the mentally ill.
Because this is about police doing their jobs better.
As the I-Team investigates police mental health training. Exactly 6 months later, tonight, the Miami Valley is remembering these 9 people killed and dozens of others hurt during the Oregon District mass shooting. This is a picture showing the 6 Dayton police officers who responded within seconds to save countless lives. And they went on to be honored by President Donald Trump.
You know, but those officers have lingering injuries that you cannot see. The I-Team's Letitia Perry got unprecedented access to show how the Dayton Police Department is showing a new commitment to help heal their mental health.
In your own head, I want you to try to rate yourself. Where am I at? 1 stinks, terrible at it. 10 is really good.
You're watching a first in Dayton police history.
Our relational and social health.
The I-Team was there just last week for the first in what will be a series of officer-required mental health care classes.
What happened in January?
This series, developed by Wright State's Department of Psychiatry and the Kettering Health Network, is a direct result of what some police officers continue to deal with. Following the Oregon District mass shooting that happened exactly 6 months ago today.
I literally saw bodies all over the place. People in suffering, bleeding, in crises. Just because we put a badge on does not make us invincible.
Dayton Police Chief Richard Beal quickly admits there are some officers who think otherwise.
Well, I can handle anything. You know, when people need help, that's when I show up. I'm the helper. I don't need help. All flawed ways of thinking.
It's officers who think like that.
You look at first responders.
The chief hopes this mental health training will reach. The sessions involve mandated classroom work and hands-on exercises. The curriculum is designed to address the long-term mental hurt and pain first responders deal with every day in the line of duty.
To see it as an injury, just like a broken arm or a broken leg, there's nothing shameful about it. It will decrease your functioning for a while, but with proper care and proper treatment, you can return back to your normal function.
So I really understand what it's like to be in difficult mental states and to be in there for a prolonged period of time.
For context, the I-Team reviewed National Officer Suicide Prevention Group Blue Help's numbers. They show reporting of verified suicides to that group has increased every year since 2016. Just last year, that included 228 active duty and retired officer suicides. That's more than were killed in the line of duty that same year.
It's our mental health. How's our outlook? Are we avoiding anxiety and worry?
Right now, the Dayton Police Department is paying for these classes. Federal dollars could soon be used to increase mental health training.
Because this is about police doing their jobs better.
Ohio Senator Sherrod Brown is one of the lawmakers behind the $15 million proposal. Supporters say over 3 years, the Department of Justice would distribute the training money so local officers would better understand how to respond, interact, and de-escalate situations with people suffering with mental illness.
Any training we can give the police to help them do their jobs better in situations that most of us have never seen. So that's why most police welcome this legislation and why I think it matters.
It matters as well to Chief Beal. Rightfully so. The officers who initially responded to the shooter on 5th Street that night have been called local heroes. They've even been honored by the President of the United States. The chief wants to make sure his officers are as strong on the inside as they are on the outside, mind, body, and spirit. And they're mentally prepared with the tools to handle the next critical incident.
That someday, you're going to look down, you're going to look at that utility belt, and you're going to look for the right tool, and it's not going to be there either because it's here, and unless you have cultivated that, you are likely going to struggle, and you can literally be brought to your knees.
That's why the chief insists, even today, 6 months after the mass shooting, that ensuring his officers' mental health care through these continuing classes is as much a priority as their physical well-being. For the I-Team, Letitia Perry, News Center 7.
The workshops Dayton officers must attend are research-based, according to the nationally recognized Penn Resilience Program. These kinds of classes increase well-being and optimism, reduces depression, anxiety, and conduct problems, and improves the physical health of the officers. Eventually, these sessions will be available to some civilians and clergy who work with Dayton police officers on a regular basis.
Such a change from what they did decades ago, too, James, because, when I covered the police department, if somebody got involved in a shooting, they went right back to work, and there was very little downtime, so it's really great to see this. Right now, you can watch the entire interview with Dayton Police Chief Richard Beal on our new and easier-to-use streaming app, WHIO TV Now. It's available for free on your Amazon Fire, Roku, Apple TV, or Smart TV App Store.